Hi, my name is Kayliana-Lani, and this is my synthesis project presentation. Why safe injections matter. Injectable cosmetic procedures continue to grow each year, but safety practices haven't kept pace with the increase in demand. Research shows that many complications occur not because of the products themselves, but because safety and injection practices vary widely between providers. Hemsworth et al. 2024, Liu and Chen 2023. Even common procedures can result in infection, inflammation, or poor cosmetic outcomes when sterile techniques or injection depth is not consistent. This project explores whether implementing a standardized aseptic technique combined with structured post-procedure education can reduce these preventable issues and strengthen safety in aesthetic practices. Description and significance of the practice problem. When complications occur, they affect patients on both a physical and emotional level. Even mild reactions such as swelling, lumps, or infections can significantly alter a patient's confidence and satisfaction, especially because these procedures involve the face. Nishimura et al. 2024. Some cases escalate and require antibiotics or corrective procedures, leading to distress and added cost. Liu and Chen 2023. Clinics also feel the impact through increased follow-up appointments, treatment revisions, and potential financial losses. Redstone et al. 2023. Beyond the clinical and financial aspects, providers have an ethical obligation to deliver safe, evidence-based care and prevent avoidable harm. American Nurses Association 2025. My PICO question examines whether a standardized aseptic technique and structured post-procedure education reduce post-injection complications within 30 days, compared with the current norm of variable individual injector practice. This population reflects the adult patients represented in a large aesthetic injection studies, such as the review by Janovskian et al. 2024. The 30-day time frame aligns with follow-up periods used in multiple safety studies, including Meneses et al. 2024 and Liu et al. 2024, where early and intermediate complications are typically observed. Summary of search and strategy results. I searched PubMed, CinAll, and ScienceDirect using Boolean combinations focused on injection complications, aseptic technique, fillers, and neuromodulators. I applied several filters for my research. I needed full-text articles available, literature that was only in English, and all published in the past 5 years. The initial search produced hundreds of results, many unrelated to aesthetic procedures. After refining and screening abstracts for relevance, 5 studies were selected. These studies were Janovskian et al. 2024, D'Amato et al. 2021, Rao et al. 2022, Liu et al. 2024, and Meneses et al. 2024. These studies directly address technique, complication prevention, or safety outcomes in aesthetic injection practice. Across the evidence base, a strong pattern emerges. Technique variation is a major driver of complications. Liu et al. 2024 demonstrated that adjusting injection depth and product layering reduced issues like the Tyndall effect, which is the adverse discoloration from incorrectly placed hyaluronic acid. D'Amato et al. 2021 found that superficial filler placement consistently caused contour irregularities and discoloration. Meneses et al. Showed that ultrasound guidance improves anatomical accuracy and reduces technique-related risk. Systematic reviews from Janovskian et al. 2024 and Rao et al. 2022 confirmed that most adverse events, like bruising, swelling, and nodules, stem from inconsistent technique or inadequate safety measures. Together, the evidence strongly supports implementing a standardized aseptic and education protocol to reduce preventable complications. Description of the setting for planned change. This change will be implemented in an outpatient aesthetic setting such as a medical, spa, or dermatology clinic, where providers have varying levels of training and experience. Stakeholders include nurse injectors, supervising providers, medical assistants, and administrative staff responsible for scheduling and communication. Patients also play a key role because their adherence to aftercare instructions directly influences complication risk. Park et al. 2024. Strong leadership support is needed to transition the protocol into clinic policy and ensure consistent training. Planned change process using a change model. I selected the PDSA model because it allows small-scale testing before full implementation. In the plan phase, a standardized aseptic checklist and post-procedure education tool are developed. During the do phase, the protocol is piloted with a small group of injectors. In the study phase, outcomes such as complication rates and adherence are compared to baseline data. Finally, the act phase involves adjusting the protocol based on results and expanding it clinic-wide. This model mirrors structured quality improvement strategies like those shown to reduce infection risks during the COVID-19 period. Redstone et al. 2023. Evaluation plan including criteria with measures. The evaluation focuses on the outcome of MyPico, the 30-day post-injection complication rate. This includes infection, swelling, nodules, erythema, and technique-related reactions, which were consistently reported across the studies in my review. Because several studies evaluated outcomes with 2 weeks to 1 month, a 30-day evaluation window aligns with the time frame already supported in the evidence. Liu et al. 2024. The complication rates before and after implementing the standardized aseptic technique and patient education protocol will be compared. Since technique variation was a major contributor to complications in the literature, the evaluation will also check for decreases in technique-related issues and review documentation for aseptic protocol adherence. Overall, the goal is to determine whether these standardized steps improve patient safety outcomes in aesthetic practice. Data collection and analysis. The data process begins with a baseline chart audit to determine current complication rates. After protocol implementation, all injection procedures will be logged prospectively using a standardized form capturing sterile steps, injection details, and any complications. Descriptive statistics will summarize results, and pre-post comparisons will determine whether the intervention leads to meaningful improvement. This structured approach aligns with the data collection methods used in previous infection prevention initiatives. Redstone et al. 2023. Plan for dissemination. Dissemination will occur at several levels. First, findings will be presented to clinical staff and integrated into standard operating procedures and onboarding. The project may also be shared with quality improvement committees. On a broader level, results could be developed into a conference poster or presentation and potentially submitted for publication, especially as research continue calling for clearer safety standards in aesthetic medicine. Ding et al. 2024, Murthy et al. 2021. Overall, the literature shows that many injection-related complications are avoidable when technique is consistent and sterile practices are clearly defined. Janovskian et al. 2024, D'Amato et al. 2021. Implementing a standardized aseptic protocol with structured education directly addresses key safety gaps. Using a PDSA approach ensures thoughtful, data-driven adoption and long-term sustainability. Ultimately, this practice change can significantly improve patient outcomes and strengthen the ethical and professional standards of aesthetic medicine. Thank you for watching.